Good afternoon, everybody, and welcome to the first seminar of the new academic year at the Geary Institute for Public Policy. Before we begin, I'd like to remind you to use the mute button during the seminar, and we will use the question and answer format to direct questions to the chair and for Michael to answer. So today I'm really delighted to welcome Michael McGann, who is a Marie Curie Fellow in the Department of Sociology and Social Sciences at Maynooth University. He specialises in street-level bureaucracy and the governance of activation, with a particular focus on issues related to welfare, to work, and the marketisation of public employment services. So his current research currently involves a study of governance of activation in Ireland, looking at the impact of recent marketisation reforms on frontline service delivery. So without further ado, Michael, I'll hand over to you. Thank you.
Thank you, Doran, and thank you for inviting me to speak this afternoon and to present on this important topic to the Geary Institute and the wider audience. And hopefully we won't be competing with too many lunchtime activities at UCD. So today I'm going to be speaking about the marketisation of frontline employment services. And what I'm going to try to do is talk not only about the Irish experience, but also about other experiences abroad that I've done research on, and that I guess that have sort of formed my own research career to date, and sort of tie that together with a wider picture about how I think competitive tendering and payment by results in terms of organising the delivery of public employment services kind of impacts and filters down through the through organisations and through to frontline employment services staff to really impact the kind of quality and nature of employability programs and job search supports that citizens on welfare payments receive from the state. So just to start off, I'll paint a bit of a picture about my own background. So as was said there in the introduction, I'm a Marie Curie Fellow at Maynooth University, where I'm undertaking a study on the governance of activation in Ireland. And what I'm doing is comparing the delivery of employment services between programs that are contracted in different ways. So programs that are contracted in a marketized way through competitive tendering and through payment by results, through programs that are publicly delivered by the state, as well as programs like community-based employment services that are delivered under contract to the government, but under non-marketized delivery structures. And I'll explain a bit what I mean about those in a few moments' time. So I did a survey last year of frontline employment services staff delivering local employment services and delivering job path, which will sort of form the crux or the bulk of today's presentation. And then recently with my colleague Mary Murphy, we've guest edited a special issue of Administration on Ireland's turn towards activation or towards welfare to work 10 years on. And this is a process that's been going on over the past decade. So we've tried to gather together some of the state-of-the-art research from colleagues at UCC, from colleagues at Maynooth, and several other places, including NESC, who have been studying the impact that the turn towards activation and welfare conditionality, but also the turn towards marketisation in employment services has had on the experience of being on welfare and on the experience of looking for work. But I also do extensive research in Australia on the marketisation of employment there. And before joining Maynooth, I worked for 4 years at the School of Social and Political Sciences at the University of Melbourne with Mark Considine, Jenny Lewis, Siobhan O'Sullivan and Foot Newen on a project on the new governance of welfare to work, which basically surveyed, was a similar type of project to what I'm doing in Ireland, which was surveying frontline employment services staff, but it's an approach that we've been doing in Australia since the late 1990s, and we have about 20 years of survey data. And some of you may have seen me present several years ago in Maynooth on this project and this body of work, but we've been tracking basically the impact of marketisation and public policy reforms at the frontline delivery of employment services in Australia and in the UK, and also with colleagues in the Netherlands as well. And it's the largest it's the largest kind of longitudinal study. Well, it's not technically longitudinal because it's not the same people we're surveying each time, but the longest kind of extensive time period of research on frontline employment services reform and the impact of reforms on frontline employment services delivery. So I'm going to bring in a bit about the Australian story to today's seminar because I think it's really important. And the approach I take is, Dora mentioned that I work in street level bureaucracy research. So what that means is that we sort of treat frontline organizations and service delivery organizations as, in a way, like de facto policymakers. We kind of reject this idea, or this idea that you can separate out policy design from administration and from the implementation of policy, because what happens in at the front line of the state is that often there's a fair bit of degree of ambiguity about policy goals, about regulations, and street level bureaucrats. These are the frontline people working at the desk in the intro office, in the local employment service, in the job path office. They have to exercise administrative discretion. They have to interpret and translate sometimes ambiguous or even conflicting policy goals and rules into practices with clients and with citizens. So this act of translating policy into practice also changes the kinds of policies that are produced. So when we talk about marketisation reforms changing where and how administrative discretion is exercised in terms of shifting the kinds of organizations that are responsible for delivering policy programs, and in terms of changing the kind of conditions, the organizational conditions, if you like, under which street level workers make decisions, whether that's through things like performance management, that can also have then impacts on changing what policies are actually delivered and enacted on the ground. So policies as written and in formal regulations, guidelines, and even in legislation are not necessarily policies as they're produced at the street level. And it's a research tradition that goes back to Michael Lipsky in the early 1980s through his research on the dilemmas of the individual in public services, and has been further developed in the work of Eva Brogdon and more recently Bernardo Sacco. And people that do research on welfare to work reform from a street level perspective tend to treat welfare governance reforms like marketisation of public employment services as a kind of double activation, where what we see is that the kind of same types of behavioral policy tools that are involved in the move towards a more conditional and more activating welfare state model, where there's increased job search obligations on claimants and there's monitoring of their performance of those job search obligations, and also potentially a threat of financial sanction and penalty if they don't fulfill their mutual commitments or their mutual obligations, is also performed on the service delivery organizations and the frontline staff themselves. So they're these kind of behavioral policy tools are cut from the same neoliberal thought as Joe Suss and his colleagues talk about as the conditionality systems designed for claimants. And I mean, I'm just pulling up a couple of quotes here from people that I've been interviewing, which I think really illustrates this point. And this first quote here at the top is from a mediator, a guidance practitioner in the local employment service, who makes this observation. What I actually find ironic is that the same fear that the pathways to work, that's Ireland's mutual commitments and activation regime program has generated with clients, is also getting more and more replicated within the organizations that are supposed to be servicing those clients. So he's drawing a parallel between the turn towards an active welfare state model and the turn towards government reforms in Ireland's employment services system that we'll go into depth in this seminar. And then underneath is a quote from someone who was involved as an advisor to the government during the period of reform over the years, sort of 2012 to 2016, when these discussions about how we would reorganize and reform the implementation structure for our public employment services were unfolding and taking place. And I was asking him about what he thought were the drivers of the move towards competitive tendering and towards marketisation. And he makes this observation. I do think that the only way to look at this is to look at what was being done beforehand, at what was being achieved without some sort of competitive process for organising the delivery of public employment services. And he's talking that going back to the pre-reform period when FOSS was managing employment services. Let's say if you were working for FOSS as a placement officer, you didn't suffer from stress. You didn't have anybody managing the number of interviews you held. Nobody was watching what you achieved in terms of getting people back to work or getting people into employment. So there would always be the tendency for agents agencies or organizations that are not driven by some sort of competitive incentive system to revert back into a fairly comfortable work environment where nobody was looking at the bottom line, which is how many people do you get back into jobs? And underlying this comment is an idea drawn from public choice economics, which is that people are inherently interested to pursue their own, to pursue their own kind of, to maximize their own self-interest, and that you've got to stimulate people to perform through external incentive structures. So unless public servants are performance managed through targets or through financial incentives, they can't be trusted to reliably do their jobs. And the British social scientist Julian McGann talks about this shift from governing public servants or public service workers as knights who are kind of have this idea that they're motivated by the public good or public interest, to governing public service workers as knaves who are motivated by little more than their own personal self-interest and their desire to avoid having to work too hard, to their desire to increase their salaries, which leads to a kind of inefficient public sector and inefficient. And this is one of the sort of classic criticisms of bureaucracies about why they lead to inefficient implementation structures, which kind of highlights the sort of, we see similar theories and ideas about agency and motivation underlying the turn towards activation and conditionality in the welfare state, that people on benefits can't be trusted to work unless they're compelled to do so. And one of the key reasons why people are on benefits and on welfare is a lack of motivation or effort on their part, and so they need to be activated through behavioral obligations and conditions into looking for work. So what I argue is that the kind of model of the welfare subject underpinning workfare or activation, and the model of the administrative subject, the public service worker, underpinning quasi-marketisation, have a shared theory of kind of agency and motivation. But what do I mean by quasi-markets in public employment services? So firstly, it's about organizing the delivery of services through competitive structures rather than state monopolies. And in theory, the best way to do this is where you have providers competing for contracts, clients, and outcome payments. But why is it quasi-market? Because not all the providers in the market are profit-driven. We can have not-for-profit providers in the quasi-market, like is very much the case in Australia. You can also have some public agencies competing in the quasi-market too for contracts and clients, as was the case when Australia first went down its road towards quasi-marketisation. But a key issue is that there's usually only one purchaser in this market, and that's the government department or the purchasing agency, which in Ireland's case is the Department of Social Protection, and they have enormous power and influence in this market because the sellers of services can't take their offers elsewhere, at least within the borders of the state, to sort of secure better conditions for their better payment conditions or better working conditions for the people delivering the program, but also for the ultimate endpoint of the people using the services. And in this case, we're talking about job seekers. They have limited consumer power. They have limited purchasing power. They rarely, unless they have purchased through vouchers or some scheme like that, which generally doesn't exist in most quasi-markets, they generally are sent or referred to a service that's been bought on their behalf by the state, and they have little say or choice over what service they receive, especially in the main area where quasi-markets are deployed, which is in welfare to work and public employment services, although we also see them in healthcare, to a lesser extent in childcare. And quasi-markets are distinct from just contracting out or just outsourcing, because the core idea is that the service delivery organizations need to be in competition with each other. And then this kind of competition between service delivery organizations drives innovation, drives efficiency, and drives better quality services ultimately. So if you're just contracting out a service to a single delivery organization, that's not quite a quasi-market structure. And I think there's actually probably a debate about whether we can say JobPath in Ireland is actually a quasi-market, because it's not internally competitive. Each of the agencies that delivers JobPath has a kind of monopoly for one half of the country in its present form, which is kind of a weakness in the model compared to the theory of quasi-markets and how they work in other countries. But I want to talk just briefly through Australia's experience of quasi-marketisation, and I'll cover this very briefly. and then move on to the Irish experience, because I think that there's patterns that emerge in the Australian experience of quasi-marketisation that we can also see being replicated in Ireland. So Australia is widely considered to be the most pioneering and bold reformer when it comes to quasi-marketisation. It was the first country that fully tendered its public employment services system, which it did in the early job network period, which was in the late 1990s. And there's essentially really three distinct periods of reform in Australia, beginning with Working Nation in the early 1990s. And what happened in the Working Nation period, which was under a Labour government, is that case management services for the unemployed, for the long-term unemployed, were contracted out to not-for-profit and private sector organisations, but the Commonwealth Employment Service, which is like the Australian equivalent of FOSS, was retained and it wasn't put into competition. So it retained a focus on the short-term unemployed, a bit like Intrio does still here today. And then they had a competitive commissioning process for very specific services, which were case management services for the long-term unemployed. But they did introduce an element of payment by results. So those not-for-profit and for-profit organizations, and there was about 300 of them at the time, received payment in the form of fixed service fees, but also in the form of fees for the outcomes achieved with clients in a payment by results model. Then what happened when the Howard government came to power in the mid to late 90s was they decided to move to a full tendering model. So they put the Commonwealth Employment Service in direct competition. What I mean by this is that the Commonwealth Employment Service, which was slightly renamed at the time, had to go into a bidding war with the not-for-profit organizations and with the for-profit organizations to win the job network contracts. So they had to be involved in bidding on price as to how much they were going to charge the government on the fixed service fees, on the outcome payments, and it was a black box contracting model. What that means is that the government basically largely paid people on the basis of the outcomes they achieved and didn't regulate very heavily in terms of what service delivery models providers had to deliver, in terms of how frequently they had to meet clients, et cetera, et cetera. Okay, so there was wide discretion given to agencies to determine the service model, how they saw fit. And then in 2003, in the late job network period, what happened was there was full privatization. And what happened here is that the publicly owned employment agency went out of business and the Australian system became fully privatized, entirely delivered by a network of for-profit and not-for-profit organizations, which remains to the case to this day. And it moved towards a hard contracting approach. And what that means is that there was increased specification of kind of minimum service standards that the providers had to achieve. There was increased kind of regulation and monitoring of providers. And one of the key reasons for this was there was widespread evidence that providers were gaming the early contracts in the job network period through practices of creaming and parking, which I'll talk about in a minute. So it moved towards a much more harder contracting approach here, sometimes called grey contracting, which is more akin to what we currently have in Ireland. And then again, there was a change of governments and a new Labour government came in and they introduced a new model called Job Services Australia. It was essentially a consolidation of what had gone before. There was a continued commitment to outcomes-based payment models and to competitive tendering. Although what's happened at this period is there was only about 100 providers left in the Australian market compared to over 300 in the Working Nation era. And then we had another change of government, and in 2015, there was a new model called Job Active, which was introduced, and that was very much more like what the UK experience was. It was a slight return to black box contracting, but also a much greater emphasis on payment by results rather than fixed service delivery fees. So payment, the proportion of funding that was delivered by outcomes rose to over 50% of the potential payments, where it was only a third under Job Services Australia. But also what happened is they moved to larger contract areas, a bit like we're seeing with the Regional Employment Service tender here in Ireland at the moment, because they're easier to manage for the department. There's fewer transaction costs involved in managing, 50 contracts covering very large geographical areas, particularly in a country like Australia, rather than managing 110 contracts that have been the case in Job Services Australia, covering much smaller areas. And one outcome or effect of that move towards financializing discretion through increased emphasis on payment by results and also through moving towards larger contract models was there was a sharp decline in the proportion of not-for-profit providers left in the Australian market, and indeed a sharp decline in the overall number of providers. So now, today, there's actually only about 40 providers left delivering Job Active. So we've moved from 300 agencies in Working Nation in the mid-90s to 40 today. And the share of contracts delivered by for-profit organisations has increased over this time as well. Ireland, by contrast, is a very late marketiser. So we came very late to the quasi-market agenda, well after most other OECD countries, and it unfolded in tandem with our move towards the more conditional welfare model under the Pathways to Work reforms, and we had the introduction of payment penalties and mutual obligations, and then we had the reform of our public employment services with Intrio replacing FOSS, then the introduction of Job Path in 2015, which was competitively tendered. Now it's delivered by two private companies, CTEC and Turris Newis, and it's up to 90% payment by results, and it's targeted at the long-term unemployed predominantly, people who've been on welfare for more than a year. But there was also changes to other contracted employment services. So we have several community delivered employment services programs in Ireland. We have the local employment service, which is targeted very much at the same cohort as Job Path, those who are long-term unemployed, but it's a legacy program from the 1990s delivered by predominantly local development companies, and it's contracted annually through kind of currently rolling over contracts on a fee for service or fixed cost met basis. And there's 22 not-for-profit companies delivering that. Then we have employability, which is predominantly focused on people on disability payments, and we have jobs clubs, which delivers a very important CV training, interview training, workshops, and so forth for a whole range of job seekers. Now, I'm not going to talk about Job Club and employability today because they're quite distinct from Job Path and the local employment service in terms of the cohorts of clients that they focus on, but they do play an important role in the broader kind of mixed economy of activation in Ireland. So I don't want to underestimate that. I focus in my research on comparing Job Path and the local employment services because they're contracted by the same department, work with very similar cohorts of clients for the same period of time, generally 12 months. But what's different between them is essentially the commissioning model. Job Path is marketized, local employment services as of yet are not marketized. So it's a really interesting case study. So why do countries turn towards quasi-marketisation? And I like to think of quasi-marketisation, quasi-markets in terms of sheep. And the analogy here is that if without quasi-markets, you get services that are like sheep. They move around in a herd. They're all kind of more or less resemble each other, and they're a bit dumb, and they're not very innovative or path breaking, or going and doing kind of new and innovative things. What you get with quasi-markets is hopefully these sheep here in the picture, who are they're moving away from the herd. They're thinking for themselves. They're going out on their own. They're trying new things, and they're not just following what's been done before. So governments like to use quasi-markets because you supposedly get this double dividend of low cost, high quality services. So you're only paying for what works because you're predominantly paying on the basis of payment by results, but also in theory, competition between providers for clients, contracts, fees, and so forth brings down the cost of service delivery, but it also should incentivize those providers to try and find new ways of working with clients, and to find new ways of working more effectively with a wider number of clients, because their financial viability depends on this. It depends on innovation, and it depends on achieving results with the most amount of people possible. So that's going to incentivize innovation. But also just from an administrative perspective, it's simpler to specify and measure what outcomes should be rather than to specify what intervention models should be, which is very, very complex for government departments and agencies to become involved with. And also in theory, you should get decentralization. So in the terms of the design of the programs and what's being provided to job seekers would then be placed in the hands of local agencies who can be a bit more flexible and personalized programs than if it was centrally coordinated by a single government department or agency for the whole of the country, and you just get a very blunt program. So that's the theory of quasi-markets. The counter perspective is you actually get herding rather than these kind of sheep I showed you on the previous slide. And there's reasons for this to do with a whole series of trade-offs that are embedded in marketisation and in the kind of mechanisms of the kind of competitive dynamics about bidding for contracts, and also about the kind of incentive for agencies to try and reduce their costs in order to bid for contracts, but also to increase their profit margins. So you get a cost quality trade-off is the argument, because one of the agencies need to win contracts and they need to be competitive with each other to win contracts. And one of their key costs is staff. It's the key input to their service delivery models. So there's an incentive for organizations to move towards lean staffing models who are managing larger caseloads, but also that those staff will be hired on lower wages and conditions, that they will potentially be less skilled staff compared to what was there previously. And if that's the case, then there also needs to be a certain degree of routinization or standardization of the kind of decision of the menus that are provided to clients, so that the service delivery model can be delivered by less skilled, less qualified staff who can follow a sort of scripted decision protocol. But also following this kind of scripted decision protocol is also important for providers' perspective, because it ensures that they're complying with the government contract. So we get a move from staff being kind of internally motivated by professional norms and by a community of practice to being extrinsically motivated in their jobs through tight supervision and through performance targets, and we get this kind of process of de-skilling, which puts downward pressure on the quality of services that are delivered. And there's also a tension between purchasing for performance or purchasing for outcomes and purchasing for inclusion. And the most famous example of that is the problem of creaming and parking, where in order to maximize their returns on contracts, providers focus their resources on those job seekers that are nearest to the labor market, because they're perceived as the clients that they're going to have the highest chance of success with, and they park those who have more complex barriers, because their chances of success and chances of achieving payments, of achieving payable outcomes with those clients are considered very, very low. So they don't invest in servicing those clients, which is kind of the opposite of what you'd want from a public policy perspective. But you also get this tension between outcomes and inclusion at a more market level, because when you move towards a more performance-based commissioning model, you kind of skew the players and the agencies that are able to compete in the market. And performance-based payment models are notoriously problematic for not-for-profit organizations to deliver, because it requires them to take on an enormous range of financial risk. But what I want to show you here is how quasi-marketisation has changed frontline delivery in Australia, and then I'll move to what the Irish research shows. And putting these together kind of gives us this combination of a telescopic view. That's the Australian case, where we have this picture over time and seeing into the distance about changes that have been happening over more than 20 years, with this kind of bifocal perspective of the Irish research that is comparing two programs in a very current context. And this enables us to control for things like policy changes over time on some of the effects that we observe in the data. So when we look at the kind of profile of people that are working in the front line of employment services in Australia, we see that it's changed massively since the 90s. And there's been a shift towards a much younger workforce, people aged 35 years or younger, but also there's been a shift towards less qualified young workforce. And we see that, for instance, in 2016 was the last time we surveyed Australian frontline employment services staff, that only just over a quarter of them, well, not even a quarter of them had a university degree, compared with nearly 40% in the late 1990s. And one of the most significant shifts we observe is the decline in rate of union membership from around 45% in the late 1990s to it's about 6% currently amongst the Australian frontline employment services staff. So this is suggesting a shift towards younger work, towards a younger, less qualified, decollectivized workforce. And in tandem with this, we see a change in the nature of discretion that frontline workers are enabled or equipped with. And we see two processes. Firstly, we see what I call supervised discretion, where the room that caseworkers report they have to move with clients has diminished radically, partly as a result of feeling that they're under more intensive scrutiny from their supervisors. So for example, when it comes to day-to-day work, I'm free to decide for myself what I will do with job seekers. So, 85% of people agreed or strongly agreed with that in the late 90s, and it's less than half today. The supervisor knows a lot about the work I do from day to day. Just over half in the late 90s. well over 3/4 in 2016. So we're seeing much tighter supervisory oversight, which comes again in the next question. When I come across something not covered by the procedural guideline, I refer to my supervisor. Massive increase in proportion responding affirmatively to that. And then also a routinization of discretion, where they're increasingly reliant on standardized decision instruments and case client assessment protocols and so forth in shaping what they should do and steps that they should take with clients. So our computer tells me what steps to take and when. Fewer than 20% agreed with that in the late 90s, and it's nearly half today. Uses standard client classification or checklists when deciding how to work with clients. Less than 30% in the late 90s, well over 60% in the most recent survey. Answers to standard set of assessment questions are very influential in determining what activities are recommended to clients. Jump again. And decisions determined by standard program rules, a good or a great deal. Again, we see a significant jump over time. But in corresponding to this, we also see a diminished emphasis on client or job seeker choice. So the extent agencies emphasize client choice about services was 40% of survey respondents. And in the Australian case, we're surveying hundreds of frontline employment services staff. So 40% agreeing with that in the late 90s, dropped to less than a third in the most recent survey. Client preferences are influential in determining what activities are recommended. Very high level of frontline staff reporting that in the late 90s, whereas that's diminished quite considerably since then. And we also see an intensification of the emphasis on applying sanctions and conditionalities to job seekers. I'm not going to run through all of this because I want to get onto the Irish data. But I think, like, if you just look at this, we asked them about the number of clients reported within the previous 2 weeks for not meeting their mutual commitments. So for potentially incurring a benefit, a payment penalty. So in the late 90s, it was less than 2% of their caseload on average that they would report in the previous 2 weeks. Whereas in 2016, this had risen to over 15% of their caseload. So I want to come on to the Irish study that I've been doing mainly last year, and it was predominantly through a survey of frontline local employment services and job path staff. So I had 112 local employment services staff take part in the survey, and I had 77 job path staff take part in the survey. As I've said, local employment services and job path aren't the entirety of Ireland's employment services system, but they're interesting case studies for understanding the impacts and effects of marketisation. And then I've supplemented this with in-depth qualitative interviews with policy stakeholders, union officials, agency managers, also with 20 of the frontline staff that have participated in the survey research, and also with job seekers themselves as well. And that's the piece of research that I'm still working on at the moment. So I won't feature too much of the job seekers interview data because I'm still in the process of analysing that. So the first thing I want to point out is we do see this remaking of street-level workers that we saw in Australia in terms of the de-skilling and decollectivization of frontline staff, and also a shift towards a younger staff. So what we see here is blue is the local employment services staff, and the bar charts of the job path staff. But we see almost an inverse in the age profile of the two staffs, where local employment services staff are predominantly over 45, and the reverse is true of job path staff. Local employment services staff, 2/3 of them are unionized. No job path staff reported being members of a trade union when I surveyed them last year. And again, the levels of qualifications reported by job path staff are lower than those reported by local employment services staff. And that's significant, I think. But I also asked about, what was the prior industry that people had worked in before employment services? And this brought up some significant differences in patterns. So we see about 1/4 of the job path frontline staff, it's advisors, reverse marketers who'd be working with employers, and site managers, come from the kind of hospitality or retail trade sectors. And then another significant proportion come from financial and insurance activities. So maybe working in selling financial services of some sort, whereas the local employment services staff come from more kind of public sector occupations, like working in education, like working in health and social work, and so on. And this comes through in the kind of subsequent interview data, where many of the job path front advisors were telling me about that they come from background in retail or a background in telemarketing. And what I found when I interviewed the local employment services staff was that many of them, almost, I think 80% of those I interviewed, it's a relatively small number, have been working in the sector for well over 20 years and have kind of come from community development backgrounds. I'm not going to go into the details here of these quotes, but you can read them there for yourself. But I also saw that the quite distinct understandings of the problem of unemployment, if you like, amongst the two employment services workforces. So there was a question in the survey about which do you think is more often to blame for people being on welfare, a lack of effort on job seekers' part or circumstances beyond their control. So this is sort of testing for, do people have kind of individualized understandings of the reasons why people are on unemployment that kind of cohere with a behavioral activation agenda, or do they have more kind of structural understandings of why people are on welfare and benefits? So we see significant differences here between the local employment services and job path staff, in terms of local employment services staff being slightly more likely to subscribe to a kind of structural understanding of unemployment. And then should benefits for people on welfare be increased compared to what they are now? Strong disagreement for this among job path staff, whereas broad support amongst local employment services staff for raising benefits. And what about benefits for younger job seekers? Again, it's kind of mixed attitudes amongst job path staff, and again, mixed attitudes among local employment services staff. And this is kind of picking up that there's something particularly negative about the way young job seekers are perceived compared to the wider pool of people who are unemployed and on welfare. And I also asked about what would you estimate the proportion of people on your caseload who would rather be on benefits than work would be, and the mean kind of among job path staff was about 40%, and among local employment services staff it was about 33%. And then again, there's just some quotes to kind of give a flavor of what that kind of survey data is telling us, which you can read for yourselves there. But I want to come on to this issue of routinized discretion that I mentioned in relation to the Australian data and what we saw over 20 years in Australia. Do we see similar tendencies occurring in Ireland? So to what extent are the decisions you make about your clients determined by standard program rules and regulations? So red is kind of, these colors of red, or shades of red I should say, are coding for kind of standardization, and green is coding for kind of more flexibility and discretion. And we do see a greater degree of emphasis on standard program rules and regulations amongst the job path staff in terms of their decision making. The influence of answers to standard set of questions in determining what activities you make for clients. Again, job path staff reporting that they're more influential compared to local employment services staff. And one of the key reasons for this is that there is a very high use of client classification and profile instruments among job path staff, where they're using a sort of standard kind of psychometric assessment tool to design personal progression plans with clients. And they're using the answers to this series of questions, and in one of the agencies it's something like 90 questions that they go through with clients that are identifying clients' strengths, their weaknesses, and issues to work on, and that's then kind of populating what their personal progression plan is going to be. And that's sort of a quote about it there. So there'd be a set of questions talking about anything, how experienced are they at job searching? Do they have any barriers or issues or financial problems that's holding them back? And that would bring up the challenges and actions that you have to look at each appointment. And the challenges and actions are what feed into job seekers' personal progression plans. So it might say the customer has difficulty in job searching or lying, or doesn't have good interview skills, etc., etc. And then they would focus on that. So there's a kind of scripted process that they go through in working with clients, which doesn't seem to be the same extent at all among the local employment services staff. But I should also point out that, local employment services staff weren't immune from being reliant on kind of computerized case management tools either. And there was a lot of resentment towards having to use the department's BOMI system, which is an information management sharing system that all mediators in the local employment services are required to interact with and to populate with data about what they're doing with clients. And there was a feeling amongst the local employment services staff, and to extent some of the job path staff as well, that this emphasis on administrative compliance and this emphasis on administrative accountability through filling information management systems with the details of clients' job plans, the details of what was involved in each meeting, was becoming the focus of employment support, rather than actually how could they work flexibly in a personalized way and an individualized way with clients. So I like this quote here, that accountability is now more important than actually the production of outcomes. The whole administration of seeing people recording stuff on Bommy, all of this is detracting from what are we doing to get people off the dole. It's like feed the Tamagotchi and forget about the core reason of why we were here. Then moving on to this question about supervised discretion. Remember that I was saying that in the Australian case that marketisation is associated with moving away from guidance of street level workers through professional norms in a community of practice towards guidance via tight performance management and supervisory oversight. And that really does come up in the data on Ireland. So this, to what extent does your supervisor know a lot about the work you do day to day? 2/3 of job path frontline staff strongly agreeing with this, compared to just 30% of local employment services staff. When I come across something not covered by the procedural guide, do I refer to my supervisor, or do I kind of exercise my own judgment and my own professional discretion? Again, job path staff far more likely to strongly agree that they'll refer to their supervisor compared to local employment services staff. But critically, job path staff are far more incentivized by outcomes and target measurement, which is not to be unexpected given that it's a payment result by results contract, but it really does come through very strongly in the survey data. To what extent are you aware that the organization you work for pays attention to the income you generate by placing clients? Very high level of awareness among frontline job path staff. So there's a kind of awareness of the commodification, if you like, of their own performance and their own outcomes with clients. Do they tend to take note of actions with clients that will generate a payable outcome? So not only are they aware of this, but does this filter through to them being mindful of what decisions they could actually implement with clients that would produce a payable outcome from the organization? And again, we see this much more strongly amongst job path staff than local employment services staff. And it should be said that local employment services staff do have targets too. They are performance managed to a degree by the department. They have to place 30% of their clients into full-time employment each year, but they're not, there's no kind of financial reward or penalty for them for achieving those targets, other than the threat, which is potentially looming particularly large at the moment, of their contracts not being renewed. And then why is all this important? Well, I think it's important because I think the routinization and supervision of discretion and emphasis on targets changes the kind of qualitatively what kind of employment service people receive, whether it's more work first orientated and based on rapidly moving people from welfare into work, or whether it's orientated more around training and reskilling. And this comes up in the survey data through several questions that we have, which are designed to kind of unpack whether people's focus is on what you might call human capital development, further education, retraining, reskilling job seekers to get to sort of find long-term career progression, as opposed to an emphasis on kind of job search monitoring and placing people into work as quickly as possible. So we asked the people in the survey, based on the practices in your office, which is the more important goal of your agency, get jobs as quickly as possible, or raise education or skill levels. And we do see quite significant differences here between the local employment services staff and between the job path staff. And another way of getting at this question is we asked, after a short time attending your service, an average job seeker is offered a low skill, low paying job that would make them better off financially. If you were asked, what would your advice be? Take the job and leave welfare, or stay on benefits and wait for a better opportunity to come along? And we can see here that there's a greater emphasis on encouraging and recommending to people that they should take the job and leave welfare at the earliest opportunity among job path staff. So this is telling us there's a more work first emphasis on local employment service among the local employment services and job path staff. And the reason why I have Australia here in these slides is I want to make the point that it's nowhere near as work first orientated as we would see in other liberal welfare regimes. So we are seeing a shift towards work first in Ireland, but it's not to the same extent that we've seen elsewhere in other countries. I'll skip over that because we're running out of time. And what about enforcing sanctions and conditionality. And this is, I think, quite a politically sensitive issue in the Irish context. And indeed, one of the agencies didn't want me to survey their staff about whether or not they would report people to the Department of Social Protection for missing appointments. So I'm a bit hesitant about how strong this data is, because the job path data is based on small numbers for this. But on this question of, does your office encourage staff to be lenient or not to be lenient in reporting clients for breaches of their mutual obligations or their mutual commitments, we see a greater emphasis on not being lenient among job path staff compared with local employment services staff. But that also came through in the qualitative interview data among the attitudes that the frontline staff I spoke to had towards sanctions and conditionality, where there was a great level of hesitancy among the mediators that I interviewed about using and applying the conditionality framework with clients. So to sum up in this very quick sweep through a lot of data, we do definitely see that marketisation has produced this pattern of de-skilling and decollectivisation in Ireland in the way that it has in Australia, and it has produced tendencies towards the routinization and supervision of frontline discretion and an emphasis on work first. But for now, we see also significant differences between the experience of marketisation in Ireland compared with, say, the UK and Australia in terms of the degree to which frontline employment service delivery is work first and sanctions orientated, and it's far less so here than in other countries that I've done, that I've surveyed. Generally, frontline staff's attitudes towards job seekers and the unemployed are softer here in Ireland. They're more likely to believe structural understandings of employment, and that applies even amongst the job path staff, than similar staff that I would have interviewed and surveyed in Australia or the UK. And although it has moved towards becoming rule-bound and standardized, not yet to the same extent that we have seen in Australia, where we're seeing well over 60% of frontline staff telling us that their computer tells them how to do their job. So I'll leave it there. I'm very happy to take questions and hear your feedback and comments.